All right, let's jump right in. We're going to be talking about systemic sclerosis, which, is a really complex condition. But what if I told you there's a single blood test that can act like a personalized roadmap, one that could basically chart a course for a patient's entire future? Well, today we're going to look at exactly how SSC specific antibodies make that happen. It's a pretty big question, right? How can just one test predict a whole lifetime of risk? I mean, for a disease that's famous for being unpredictable, that idea seems, well, almost impossible. But that's the promise we're going to unpack today. How do we take one little data point and turn it into a proactive plan for life? So, here's the fundamental problem with systemic sclerosis. It's not just one disease, not at all. It's a spectrum, and its course is super variable. Some people might have a pretty mild journey, while others could face these rapid, really life-threatening complications. And that variability, it just creates this huge cloud of uncertainty for everyone involved, patients and doctors alike. But right in the middle of all that uncertainty, we have an incredibly powerful tool. The answer is found in autoantibodies. And we're not talking about just any general markers here. No, these are highly specific keys that can actually unlock the exact type of SSC a person has, giving us our first real solid piece of the puzzle. This really shows the difference between, casting a super wide net versus using a precision tool. A general test, like an anti-nuclear antibody or ANA test, yeah, it's going to be positive in over 90% of patients with SSC. That's what we call high sensitivity. It's great at telling you something is going on, but it's not specific at all. Now, SSC-specific antibodies, they're totally different. They're like a GPS coordinate for the disease. They don't just suggest a diagnosis, they lock it in with incredible precision, and, this is the key part, they unlock that personalized roadmap we've been talking about. So that brings us to the core group of tests, the main diagnostic panel. Think of these as three essential signposts that give us the foundational information we need. They are the big three: anti-centromere antibodies, or ACA, anti-topoisomerase 1, which you'll often hear called SCL70, and anti-RNA polymerase 3, or RNAP3 for short. These three are the bedrock. And this, right here, is where things get really amazing. These antibodies do so much more than just diagnose what's happening today. They literally act as a blueprint for the future. They let us decode a patient's risk profile and see what potential complications might be waiting for them, sometimes years down the road. So the most important thing to get is this. Each one of these antibodies tells a completely different story about the journey ahead. They aren't just clinical labels. They're basically a narrative of what could happen in the future. And here are those stories, laid out plain and simple. If your test comes back positive for ACA, your story is often about limited skin disease. But, and it's a big but, we have to be on high alert for pulmonary hypertension. Now, if you're positive for ATA or SCL70, the story's focus shifts completely to the lungs, specifically a risk for severe lung scarring. And then there's RNAP3. That narrative is about a potential for a really rapid onset, with the biggest risks being a dangerous kidney problem called scleroderma renal crisis, and even a higher risk of cancer right around the time of diagnosis. This brings us to a really critical clinical pearl. You got to think of these tests as two things. They're anchors that lock down the diagnosis, and they're stratifiers that sort people into different risk groups for the future. So what aren't they? They are not disease activity markers. They don't go up and down with your daily symptoms, and we're going to circle back to why that's so important in a bit. Okay, so knowing the risk is one thing, but actually doing something about it, that's what really matters. The true power of having this prognostic blueprint is that it lets us build a proactive, totally personalized surveillance plan. We can stop just reacting to problems after they show up and start actively looking for them before they become a big deal. So let's walk through an example. Let's say that first antibody test is positive for ACA. Right away, that roadmap is pointing to a lifelong risk of pulmonary hypertension. So what does the action plan look like then? It becomes super clear and structured. We're talking an annual echocardiogram to check for pressure changes in the heart, an annual lung capacity test to catch any early signs of trouble. And we really focus on proactively preventing other issues like digital ischemia. It's a targeted, preventative game plan. Okay, now what if the roadmap points us in a totally different direction? What if that key signpost was ATA, or SCL70, which signals a high risk for interstitial lung disease, lung scarring. The whole plan changes. The surveillance becomes way more intense, especially in the beginning. We're talking about pulmonary function tests every 3 to 6 months for the first couple of years. We get a baseline high-resolution CT scan of the lungs so we have a clear picture from the start, and then we just watch incredibly closely for any sign of progression. All right, let's look at our third and final roadmap. This one's for patients who are positive for the RNA-P3 antibody. Here, the big worries are the kidneys and that potential risk of malignancy. For this group, the action plan is all about vigilance. It means super tight blood pressure monitoring, because a sudden spike can be the very first sign of renal crisis. It means regular blood and urine tests to keep a close eye on kidney function, and it means being diligent about cancer screening, starting right from diagnosis and continuing on. So you see, 3 different antibodies, 3 totally different game plans. So we've seen just how powerful these tests can be, and that naturally leads to a golden rule for how to use them, knowing exactly when to order them, and maybe even more importantly, when not to. And this goes right back to that point we made earlier. A disease activity marker is a test you repeat to see if a disease is flaring up or calming down. These SSC antibody tests are not that. The levels of these antibodies almost never change in a meaningful way, and they absolutely do not track with how a patient is feeling on any given day. This timeline makes that rule crystal clear. You order the core panel once, at the initial diagnosis, and that's to establish the lifelong roadmap. Now, you might think about an extended panel later on if the disease starts looking weird or suggests it's overlapping with another condition. But for routine ongoing monitoring, nope. Retesting is not recommended. It doesn't give you useful info, and it just adds unnecessary costs. And here we are again, back to what is probably the single most important takeaway from all of this. Seriously, if you remember just one thing, let it be this. SSC antibodies are diagnostic anchors and prognostic stratifiers. They are absolutely not disease activity markers. Their job is to set the course for the whole journey, not to give you a daily weather report on how things are going. And that really is the journey we've just walked through. We started with this confusing puzzle, right? A disease spectrum just filled with so much uncertainty. But by using these specific antibody tests, we can transform that puzzle into an empowered, proactive, and truly personalized plan. It's a fantastic shift from just reacting to problems to actually predicting them. Which kind of leaves us with one last big thought to chew on. This is just one example in one disease. As our science gets better, as our understanding of immunology and genetics gets deeper, just imagine what other kinds of roadmaps are waiting to be discovered inside our own biology, ready to turn uncertainty into clarity for who knows how many other conditions.